As a parent, one of the most nerve-wracking experiences is discovering that your child has a fever. That all too familiar warmth on their forehead is often followed by the confirmation from a thermometer. But how serious is this fever, and what steps should you take next? In this video, we'll explore essential steps for comforting your child, managing their fever, and ensuring they stay safe. We'll also cover common mistakes to avoid and when it's time to call the doctor. Understanding fever, the body's natural defense. Fever is often a sign that your child's body is fighting off an infection. It's their body's natural response to germs, as raising their temperature can help kill bacteria or viruses. In most cases, fever is harmless and will subside on its own in a few days. Still, knowing how to handle it can bring comfort to both you and your child. A fever typically lasts for 3 days and is usually no cause for alarm. But let's walk through how you can make your little one more comfortable during this time. What to do when your child has a fever. Administer fever-reducing medicine. Acetaminophen, one of the most common medications for lowering your child's fever, is acetaminophen. If your child is older than 2 years old, the dosage will be listed on the label. However, if your child is younger than 2, it's best to consult your doctor for the appropriate dosage. Ibuprofen, another option is ibuprofen, but it's only safe for children over 6 months of age. As with acetaminophen, be sure to follow the dosage instructions closely. Provide comfort measures. There are several non-medicinal ways to make your child feel more comfortable. Place a cool compress on their forehead to bring down the temperature naturally. Keep their environment comfortable by maintaining the room at a moderate temperature, neither too hot nor too cold. Dress your child in light clothing to avoid trapping heat. Offer them a light blanket to keep them comfortable. Give them a lukewarm sponge bath to help reduce their temperature. Avoid cold baths, as these can cause the body to react by increasing the fever. Hydration is key. Make sure your child drinks plenty of fluids. Fever can cause dehydration, so it's essential to keep your child well hydrated. Offer them water, clear soups, or electrolyte-rich drinks. What to avoid when treating a fever. No aspirin for children. Never give your child aspirin. It can lead to a potentially life-threatening condition called Reye's syndrome, which affects the brain and liver. Avoid over-the-counter cold and flu medicines for young children. Children under 4 years old should never be given combination cold and flu medicines. If your child is over 2 years old, consult your pediatrician before administering any type of cough or cold medicine. According to the FDA, these medications can have serious side effects, and in some cases, they may be life-threatening, especially in children under the age of 2. Always check the label carefully, and if you're unsure, consult your doctor before switching between medications. No icy cold baths or alcohol rubs. While you may be tempted to use an icy cold bath to bring down a fever, doing so can actually backfire. The sudden drop in external temperature may cause your child's internal temperature to rise even more. Similarly, rubbing alcohol on the skin can lead to an increase in fever and is dangerous. Don't overbundle. Even if your child is experiencing chills, resist the urge to pile on blankets or extra clothing. Overbundling can trap heat and make the fever worse. Instead, stick to light layers and make sure your child is comfortable. When to call the doctor. While most fevers are harmless and subside on their own, certain symptoms should prompt you to contact your pediatrician immediately. If your child's temperature is 104 degrees Fahrenheit 40 degrees Celsius or higher. If your baby is under 3 months old and has a temperature of 104 degrees Fahrenheit 38 degrees Celsius or higher. If your child's fever lasts longer than 72 hours or more than 24 hours if they are under 2 years old. If the fever is accompanied by severe symptoms, such as a stiff neck, rash, extremely sore throat, ear pain, or severe headache. If your child has a seizure or appears very sick and unresponsive. Being proactive and monitoring these warning signs can help you ensure your child gets the care they need at the right time. Taking your child's temperature. Best practices: you don't need to check your child's temperature obsessively, especially if they're sleeping comfortably. However, you should check it if their energy levels seem lower than usual. They have a history of febrile seizures. When it comes to choosing the right thermometer, digital thermometers are your best option. They are easy to use and provide accurate results. Depending on your child's age, for babies and toddlers, rectal thermometers are the most reliable. For older children, 4 to 5 years and older, an oral thermometer can give a good reading. Underarm thermometers can also be used, but remember to add 1 degree to get a more accurate reading. Final tips. Managing your child's fever doesn't have to be a stressful experience. By following the right steps, such as administering the appropriate medications, providing comfort, and avoiding common mistakes, you can help your child feel better in no time. However, it's essential to know when a fever is something more serious. Trust your instincts, and don't hesitate to reach out to your pediatrician when necessary. Stay informed and prepared, and remember that a fever is often just a sign that your child's immune system is doing its job. For more helpful parenting tips and health advice, subscribe to our channel and hit the notification bell to stay updated.